Head of Science and Research at Biome9, and I'm going to spend this session decoding dysbiosis, but not just dysbiosis, a lot of the other buzzwords that people are using in the microbiome at the moment. So during this session, I'm going to be covering an introduction just to Biome9 and also what is the gut microbiome for anyone who might not be familiar with it, as well as what is this term I'm using, dysbiosis, why it matters in practice, and then what you can actually do about it to correct it and rebalance. I'm going to give some case study examples of where we've measured dysbiosis and actually acted upon it, and hopefully get you excited about this being some of the future of veterinary medicine. I know there's a number of people here who had already come and visited us on the Biome9 stand, so really great to be able to see you all here. If you haven't visited the stand yet, do come down to E60 afterwards, and there's lots of goodie bags at the front as well before you leave. I first wanted just to introduce you guys to Biome9. So we actually launched at London Vet Show in 2023. So this is going to be, our third proper London Vet Show. And it's really exciting to show you just how much we have changed and how much our science and research is coming along and how many more dogs we've been helping. So we pre-launched back in November 2023, had our first gut discovery going out in January 2024. Came back to the London Vet Show the following year, and of January this year, we were actually acquired by a pet food company called Pooch and Mud. From then, we've actually moved our flagship gut discovery service purely to being a B2B model. This means that we can really focus on providing the best and most informative science directly to vet professionals and other canine professionals. As of October, we've just expanded and invested into a new lab in Aberystwyth in Wales. And here we are at our London Vet Show 2025. Also launching this month our free microbiome CPD for vet professionals and a few peer-reviewed papers that will be coming out in December. We did our first results back in March 2024, and already we're over 2,075 dog samples, all from the UK. When we talk about gut health, we're not just talking about digestion. We're talking about the foundation of the immune system, metabolism, and even behaviour. Let's put this in the UK clinical context. Chronic enteropathies affect around 2% of dogs. That's around 110,000 to 220,000 dogs a year. Atopic dermatitis, expected to affect over 1 million dogs. We know that almost half the dogs in the UK are overweight or obese. All these conditions have such strong links to the gut microbiome. We're seeing similar connections with neurological and behaviour issues too, what's often called the gut-brain axis. So when we understand the microbiome, we're not adding another test, we're adding a lens that helps make sense of a complex and chronic case. That's why gut health matters now more than ever. Just from our database alone, we see that 56%, so more than half the dogs, are already experiencing more than 2 gut symptoms, which very much aligns with what we know based on the UK landscape. So what is this term dysbiosis and why would it matter to you? I want to first explain the microbiome for anyone that's unfamiliar. Imagine you are walking your dog through a forest and you notice the trees in the forest. Is it the type of forest that has lots of different species of trees? We would call this a rich forest. Is it a forest that only has one type of tree? We'd say that this was a balanced forest. All the trees are in proportion to each other. But the best kind of forest is one that has lots of different trees that are all equally proportioned. We'd call this rich and balanced. The reason I use this, these trees are also producing things like oxygen, carbon dioxide, and water that is helping to feed that ecosystem. And the reason I use this example is because it directly translates to the dog's gut microbiome. Instead of trees, they have bacteria, but it's still an ecosystem. Just like the trees are making the oxygen, water, and carbon dioxide, the dog's microbiome is making acids and sugars and alcohols as it's fermenting and digesting the foods, and we call this the dog metabolome. In a healthy canine microbiome where we've got a good balance of bacteria that are well proportioned with each other. So they've got that richness and that balance. We'd actually say this was a good diversity. Diversity really looks at both that richness and that balance to give a standardized metric. So with a good diversity, we've got that different bacterial species in good proportions. Dysbiosis occurs when the gut ecosystem is disrupted and that microbial balance is lost. Often this can happen by a particular bacteria overgrowing, therefore dominating the entire microbiome. When this occurs, if it's left untreated, it actually results in inflammation in the epithelial cells. That inflammation can then trigger the cytokines, thereby causing inflammation that can spread across the entire body. Just as the alcohols and acids and sugars are important and being created in that balanced, diverse ecosystem, the same thing happens, but disproportionately when we see that dysbiosis. So as well as the inflammation, it's also affecting things like neurotransmitters, cytokines, and even hormones. We've recently done a piece of research that actually looked at female neutered dogs and how different their microbiomes are after they've been neutered. It's important to understand the word dysbiosis can only be used when we have a clear idea of what a balanced, healthy microbiome could look like. In humans, we can't actually use the term dysbiosis. Human microbiomes vary enormously by geography, diet, lifestyle, age, and in human studies, that term dysbiosis has to be used very cautiously. But in dogs, we see so much stability. We can define that balanced microbiome with much greater confidence because dogs have more consistent diets, shorter lifespans, and fewer lifestyle variations than what humans do. This is what allows us to identify those bacterial shifts when the beneficial groups are depleted and opportunistic groups expand. So the most typical definition of dysbiosis is an imbalance in the different microorganisms living in a microbiome. The gut's not the only place with a microbiome. There is a skin microbiome, an oral microbiome. This room has a microbiome. These chairs have a microbiome. It's any environment with that ecosystem of microorganisms. But we really like to focus on canine fecal samples, which is what we sample. And so when we're talking about dysbiosis, we're really thinking about that imbalance in the gut ecosystem where beneficial and opportunistic bacteria are disrupted. So a healthy microbiome may look like this, where it is balanced and well proportioned. A dysbiosis microbiome may be due to one bacteria overgrowing. It could be a combination of one bacteria overgrowing and the loss of other bacteria, or it could just be a simple loss. The point is we know what a good, stable, diverse canine microbiome looks like. And when it doesn't look like that, to varying degrees, we can start to see what dysbiosis actually is. This is also why dysbiosis is a meaningful and measurable concept in veterinary medicine, and why microbiome testing can give us clinically relevant insights into where that gut ecosystem is drifting out of balance. So we can only call it dysbiosis when we know what balance looks like. We can think about dysbiosis in two forms. Clinical dysbiosis is the one that vets probably would recognize most easily as it's linked to disease. The imbalance in the microbiome is contributing to the problem, whether that's chronic diarrhea, IBD, or recurrent skin issues, or even a post-antibiotic instability. These dogs where dysbiosis is part of the pathology and it needs direct management. Then there's also functional dysbiosis, and this, on the other hand, is much more subtle. The dog may appear outwardly normal, but the microbial ecosystem is shifted, and certain groups are depleted, others are overgrowing, or key functions are missing. It's not always causative, but it is meaningful. Functional dysbiosis can signal reduced resilience, increased risk of pathogens, or an early imbalance before disease develops. In practice, this distinction is important because functional dysbiosis is where we can actually intervene quite early and use this in a proactive manner with nutrition and lifestyle changes, whereas clinical dysbiosis is where we need a more targeted plan. As an example of dogs with clinical dysbiosis, this is a stacked bar chart. So each single vertical line is one dog, and every color is a different bacterial species. In this healthy cohort, we've included dogs with no clinical symptoms or intolerances, good body and fecal condition, no antibiotics in the last 6 months, with up-to-date vaccination and worming. We use this really strict criteria, and we often source these dogs from working populations such as the Guide Dogs Association. This allows us to actually use statistical modeling in order to determine what is healthy and what is dysbiosis. When we look at dogs that have been diagnosed with atopic dermatitis, we can see a clear difference between that healthy, stable, balanced microbiome and losing some of that balance and seeing a lot more irregularity with atopic dermatitis. What's really interesting is when we also include dogs with chronic enteropathies. So these are ones that have been diagnosed with IBD and are also experiencing diarrhea. We can see a really similar pattern. The atopic dermatitis and chronic enteropathy may be quite different, but it's being able to compare them to healthy that tells us about the clinical dysbiosis. So what you can see is, although each vertical line is one dog and each dog has a unique microbial fingerprint, the healthy dogs do show a more consistent pattern and stability in their community structure. Whereas in contrast, the dogs with atopic dermatitis and chronic enteropathies display far more variability and disruption. And I really think that this visual difference helps to highlight how dysbiosis presents in real clinical populations. When we look at all of those kind of merged together, giving an average of each of those groups, in clinical dysbiosis, we tend to see two major patterns: an overgrowth of a small number of common bacterial species and a loss of many low abundant species. So that's the pink line right at the bottom. These really contribute to that richness and stability shown in the pink. The 4 species we most consistently see shifting are Peptoaciobacter hieronymus, Blautia hansenii, Ruminococcus narvis, and Faeculobacterium umbilicata. These are the top 4 dogs that we've highlighted, top 4 species that we've highlighted with the colours relating to the graph. In healthy dogs, they also have these 4 species, but they're making up less than half of the total microbiome. In dogs with clinical dysbiosis, they're accounting for up to 75% of the total ecosystem. And that shows how the ecosystem's just become dominated by just a few groups. Importantly, these are not bad bacteria. They're not pathogenic or disease-causing. Peptoaciobacter hieronymus and Blautia hansenii, the top 2 in red and in orange, are essential for bile acid metabolism. They're actually key species in dogs as markers of dysbiosis and gut function. The problem is not that they're there. The problem is their proportion, and this is what holds most relation to the rest of the community. Ruminococcus narvis, I also always like to highlight. That's the 3rd one down of our most common species. This is a really well-recognized marker of gut inflammation. We see in both humans and dogs that have been diagnosed with IBD, this bacteria species is massively elevated. It doesn't mean it's causing it. It's more of a correlation, but it is a really, really clear marker. We don't know if Ruminococcus narvis is trying to help the situation or is contributing, but it's interesting that we see this consistency across both of the species. So when we do see these species expanding and those rare species collapsing, this is a clear signature of dysbiosis in the canine gut. In terms of that functional dysbiosis, This first chart is showing you the proportion of dogs in our database with one or more self-reported symptoms of gastric unrest. So importantly, the population of dogs we're talking about now are not ones that have been given a clinical diagnosis. Things like intermittent soft stools, fat flatulence, and variable appetite, occasional vomiting. So no formal diagnosis, but recurring gastric unrest being reported. If we look at that healthy dog population again, with each bar representing one dog and each color representing one of those top 25 core bacterial species, we can again see that clear, consistent, stable pattern across the cohort. This is what a balanced microbiome looks like, the reference we rely on when defining dysbiosis. But now let's reveal a subset of dogs that have multiple symptoms, such as soft stool, flatulence, variable appetite, and occasional vomiting. Immediately, this difference is obvious. Immediately, this difference is obvious. Each dog is unique, but there's no consistent pattern in these dogs with the gastric unrest. There's a lot more variability and clear shifts in that relative abundance. This is a disrupted ecosystem and reinforces the point we made earlier. We can only call it dysbiosis when we know what balance looks like. In these functional dysbiosis cases, the microbiome has moved away from that healthy baseline even before overt disease develops. It shows us that dysbiosis isn't just a label, this is a measurable, actionable change in the gut ecosystem. So healthy is stable and consistent, dysbiosis, disrupted and variable. But dysbiosis is not a diagnosis, it is a biological state, and it shapes the disease risk and outcomes. So it's really important to emphasize that it's not that you can say this dog has dysbiosis and they're suffering from it. The dysbiosis is contributing to other factors and other issues. So interpreting the gut microbiome metrics, understanding these shifts in key bacterial groups and recognizing the patterns that signal these early or functional dysbiosis is key. And the goal for us is to give you actionable insights so you can make informed decisions on nutrition management, preventative care, lifestyle changes without overstepping into diagnosis. The reason this matters so much in practice, we talk a lot about skin issues, atopic dermatitis, gastric unrest, IBD, but it's not just a gut problem, it's a whole animal issue. We know when there is an issue with the microbiome, this will affect digestion and thereby the amount of nutritional intake a dog is able to get from their diet. And when this is inadequate, it results in flatulence and malodor. But it can also exacerbate allergies and intolerances because of that effect with the immunity and inflammation. That inflammation, as I mentioned before, once dysbiosis occurs and the inflammation is left unchecked, can spread to affecting skin, coats, even joints, as well as brain. And this is how we can start to understand the link with behavior and neurology. When we think about dysbiosis related cases in practice, it's helpful to use this acronym GUTS. So we say looking for gastrointestinal issues, unexplained behavioral changes, treatment with the antibiotic history, and skin irritation. These are the most common contexts where a disrupted microbiome can be contributing. Those gastrointestinal issues are the most obvious: the chronic diarrhea, constipation, vomiting, acid reflux, excessive flatulence, anal gland problems, abdominal discomfort. The unexplained behavioral changes can also be linked to the gut imbalances, whether that's anxiety and aggression or changes in behavior, even changes in eating habits and resource guarding behaviors. We get a lot of inquiries around dogs that suddenly start practicing things like coprophagy or suddenly start eating things that they're not supposed to be eating. We get a lot of inquiries about this. And it is difficult to be able to say this is a behavioral or a gut microbiome issue. But by addressing the gut microbiome and eliminating that as an issue, you can then either fix what that issue was or start to focus on the behavior, having ruled this out. A common thing we also see in terms of those unexplained behavioral changes is it's hidden pain. If a dog has something else going on and they've got this disruption in the gut and they've got this inflammation, they're going to be acting out anxiously or aggressively because of this hidden pain that's not been identified. The skin irritation is such a key indicator for us. So whether that's the chronic itching, paw chewing, or the atopic dermatitis, fur loss, any of them. And speaking to a lot of people today, very common for you all to see gut and skin issues concurrently. Many of these cases are complex, they're multifactorial, and it's really frustrating to manage, which is why understanding the microbiome adds real value. By assessing that gut balance, we can provide nutritional guidance as well as guidance on lifestyle or even supplement support in a targeted way. It's also worth noting that insurers are increasingly recognizing the gut microbiome testing, supporting early interventions because it can reduce the recurrent veterinary visits or complications. So particularly when it's recommended in clinic with these specific cases and symptoms, it's routinely being covered by many of the pet insurers. And then what do you do about it? If a dog has dysbiosis and you've got the results and you need to restore that balance, once we have identified that, you want to consider some of the common disturbances, which could be changes in medication, changes in environment, things like boarding or travel or moving homes, and even dietary changes, whether sudden switches in food or introduction of a new treat. These events can shift that microbial ecosystem, sometimes temporarily, sometimes more persistently. The goal is to restore the balance, diversity, and resilience of the gut. And rebalancing is not just about targeting one single species. There isn't a one-size-fits-all approach. It's about supporting that entire ecosystem as a whole. So using nutrition, prebiotics, management of strategies, lifestyle, all for the individual dog. After we've identified that disturbance and we've started the process of restoring gut balance, the next step is to use that microbiome data in a practical way to guide interventions. Many factors can impact the microbiome, as I just mentioned, whether that's the diet, supplements, lifestyle, medication, and these are all tools that we can also use to target the recovery. The approach is to combine multiple strategies to help rebalance the gut. So with supplements, whether they are pre, pro, post, or synbiotics, can help support recovery of those beneficial bacteria and restore functional balance. Nutritional support can be really well tailored for dietary intervention, whether that's elimination diets, addressing allergies or intolerances, or adding very specific nutrients, which can reinforce microbial stability. Lifestyle management is something we do a lot of research on. So we found that dogs that have more than 45 to 60 minutes of physical activity a day tend to score much higher in their microbiome scores. Sleeping is also a really interesting one we've recently discovered. Dogs that sleep in their own beds have better microbiome diversity and gut health than those that share their beds with their owners, which is really shocking and was very upsetting because I do share my bed with my dog. So just these small changes to lifestyle, prioritizing a dog's sleeping area, how much time they're spending outside and exercising are all great strategies to address the microbiome. And then following up and monitoring. By using microbiome testing, it gives us a measurable, quantifiable way to be able to track any changes and see the effects of any interventions. So using this structured approach, we can help to translate that microbiome information into actionable steps and guiding dogs back to a really healthy and balanced gut. We take a 6-month approach where we make our recommendations. We use this strategy of restore, repopulate, and optimize. Because when we're talking about restoring gut balance, it's important to remember that any supplement or probiotic is likely to have an effect, but this one-size-fits-all approach is just not working. Each dog's microbiome is unique. You saw even within those healthy populations, each dog was ever so slightly variable. So interventions do need to be bespoke, guided by what the ecosystem actually requires. So we use this three-phased approach to help structure that support. In phase one, we're all about restoring. So using things like prebiotics, high fiber feeds to help feed the bacteria that's already present and also prime the ecosystem so that when you come to phase two, repopulate from about 2 months onwards, we want to introduce those probiotic live bacteria to colonize the gut. Because we've already done the restoring, it's more likely they are actually going to colonize and become long-term members. And phase three is all about optimizing. So using things like postbiotics, which are extremely stable, or symbiotics, which actually combine everything together to help reinforce the new microbiome that has been created using bacterial components rather than relying on the live microorganisms. And the goal isn't a quick fix or just adding more bacteria indiscriminately over time. Any probiotic can lose effectiveness if it's not targeted to the dog's microbiome. So instead, we focus on long-term resilience, rebuilding the gut ecosystem so it maintains its balance and stability, not just richness. Different categories of supplements target the microbiome in different ways, feeding, introducing, or reinforcing. And tools like gut discovery can really help us determine which approach is most appropriate for each individual dog. Speaking about diets and one-size-fits-all approaches, a common thing that we get asked when it comes to testing the microbiome is about dog's diet. What should I feed my dog? What's better, kibble or raw? What we find is actually different diets suit different dogs. Diet is one of the biggest influences on the gut microbiome, but just like supplements, we're saying this one-size-fits-all approach does not work. Different feeding strategies shape the microbiome in very distinct ways. Raw-fed dogs tend to have much higher species richness because it helps to introduce some of those low abundant microbes, helping with overall function. However, kibble diets support higher overall diversity, creating a more evenly distribution of those core species, which leads to a more stable gut ecosystem. And that's crucial for long-term health and resilience. So the key takeaway is that no single diet is ideal for every dog. If you do a test and see really low richness, it might be worth considering adding some raw or additional protein to the dog's diet. If the dog is really struggling with stability, then a kibble diet is going to be very suitable for them. So it's all about tailoring the nutritional needs to each individual in order to balance and create that diverse, stable microbiome. We also provide complementary nutritional support. So this is all about enhancing the dog's current diet, not replacing it entirely. Microbiome testing can highlight functional weaknesses, so areas where those microbial groups or functions are underrepresented. And this helps us to guide targeted adjustments. So everyday feeding recommendations are designed to work with the dog's existing diets. They involve small, practical changes that benefit the microbiome without overhauling the food the dog is already on. Superfoods are our suggestions of how these things can be added alongside the main diet, like a spoonful of sauerkraut or a small piece of fish to provide additional microbial nutritional support. These are intended as daily additions rather than replacements. Foods to avoid are also highlighted. Even obvious items like processed carbs or refined sugars can sneak into treats and snacks. So guiding owners to identify and reduce these hidden sources can help support that microbiome balance. Ultimately, this approach is giving vet professionals and owners the information and guidance to make practical, data-driven nutritional changes, supporting gut health and long-term microbial resilience. So based on these insights, we can make those targeted recommendations to enrich the dog's current diet, whether that is adding specific fibers, prebiotics, or specific nutrients to help support the gut health. The role of the complementary nutrition is to enhance what's already there. So supporting the current balance and giving the dog the best chance at long-term good gut health, guided by our data and tailored to being used in practice. Lifestyle is another major driver of the gut microbiome. Obviously, diets and supplements are a really easy and targeted way to restore that balance and correct that dysbiosis. But alongside diet and medical history, we also collect data on geographical or household animal sleeping arrangement, daily exercise. This helps us at Biome 9 create a fuller picture and understanding of how environment can shape and affect the dog's gut. Body condition is already very strongly linked to microbiome health. Dogs with an obese body score show consistently lower diversity, richness, resilience, and balance. And this mirrors the wider scientific literature conducted on obesity with the microbiome. Our data set aligns really well with these established findings. So this gives us a nice validation of the research we're doing. Physical activity also supports a healthier gut. So dogs with more than an hour of daily exercise have noticeably better microbiome scores than those that have very little activity. Exercise helps to improve gut motility and transit, which helps maintain a stable and diverse community. The clinical relevance is that for dogs that are obese or very inactive, microbiome testing can offer targeted insight and guide personalized interventions. So just small lifestyle adjustments can actually lead to measurable improvements. The microbiome adapts gradually. In the first few weeks, it's very normal to see temporary changes such as mild gas or slightly looser stools. These are signs of microbial adjustment, not harm. We can start to detect measurable microbial shifts just from 2 to 4 weeks after intervention. But the most meaningful changes occur at around 6 to 8 weeks. And many dogs have that improved stability as from about 10 weeks onwards. The external signs, however, do lag behind internal recovery. But our data shows the long-term trajectory. So after 6 months of targeted support, 83% of dogs showed improved microbiome scores. The graphs on this slide just illustrate that before and after the changes for balance and for richness. Owners noticed these improvements too. Within 10 weeks, 80% had reported positive outcomes from further stools, better behaviour, and reduced itching. But the pace of the responses does vary. Some dogs improve really quickly, while others take a little longer. It really depends on the initial level of dysbiosis. Tracking symptoms alongside the microbiome data is essential. Retesting can help us to confirm the internal progress, even when the outward symptoms are fluctuating. With the dysbiosis data, we don't rely on one single number. We're looking at multiple complementary metrics. So the richness, how many species are there, the diversity, how evenly those species are spread and how many, and that balance, so the relative proportion, as well as the resilience, how stable it is. Together, these give us that really robust picture of a gut ecosystem and the health. So this is our gut microbiome kit. If you hadn't had an opportunity to see it yet, do come and visit us at E60. So I also have another one here, so you're welcome to come and have a play around with one at the end of the session. So owners collect the sample at home and post it directly to our labs in Wales. They don't need to come back to the practice with their fecal sample, reducing the burden on the clinics. We register the sample on receipt, provide status updates so the owner knows when the sample has arrived and when it's being processed and when they'll receive their results. This workflow is really aiming to reduce the burden on clinics as well as improving compliance. Owners find it easy to take samples in a familiar setting, and vets get timely, actionable reports that are linked to these clinical cases. So once a patient is presenting with one of the symptoms using that GUTS acronym we introduced earlier, they send off their stool sample directly to our lab. Within 2 weeks, they will get their report. Vets will also receive the report, as well as a complete breakdown of the dog's entire microbiome. As well as getting a digital format of the report, you'll get an Excel format, so it's a really easy results readout. The vets can then consult other diagnostics or use it to rule or confirm out what else is going on in these complex cases. Then implementing dietary changes or any of the supplements. And you can also consult with us at Biome 9 at any time for any of the patients. So we provide microbiology consultation for any particular cases that you are interested in. So that is a support that you kind of always have moving forward. Traditional fecal testing still remains essential. So microbiology, PCR, parasite screens, they all tell us what's there right now. And this is essential for acute infections, but they are limited. They can't tell you why a dog's gut is struggling or what's happening to the beneficial bacteria that keep it stable. And so gut discovery aims to go further. By sequencing the full microbial community, we can detect these early signs of imbalance or even pathogenic overgrowth before the symptoms appear. And because it connects those microbial patterns with nutrition, it's really helping vet professionals make evidence-based dietary or probiotic recommendations. It's not about replacing traditional tests. It's about complementing them to give a fuller picture of gut health. Together, they can deliver infection detection and insights into functional gut health in a proactive or reactive way. Thinking about that proactive use, I wanted to give a case study example of how we've been able to manage pathogens through microbiome restoration. Here we have 2 examples showing how microbiome restoration alone was able to reduce pathogenic species without the need of antibiotics in appropriate cases. So in the first case, you can see the eradication of 3 pathogenic species in dog 1. So we saw Campylobacter jejuni, Salmonella, and Clostridium perfringens. And by the 3rd test at 6 months in pink, all of these had completely disappeared from the gut purely by using dietary management and supplements. This is really by strengthening the beneficial community. So there's no ecological space for those pathogens to be able to persist. But we've seen this pattern repeated in multiple dogs. So this second graph is showing 3 further cases where that pathogenic overgrowth resolved on retesting. And importantly, these were not borderline detections. These were actually quite meaningful reductions. It's important to stress that low level presence of many of these pathogenic species is super normal in dogs. And when dogs have good stability and resilience and diversity, it doesn't cause any issues. But the moment that dog undergoes some kind of gastric stress, whether that is eating something it shouldn't or one of those changes in diets or medication, it creates an opportunity for these pathogens to then overgrow, which results in developing an infection. So the problem arises when there's a disturbance, whether that's the medication, diet change, stress, or illness, and that disrupts the ecosystem. This is where the microbiome testing does become really, really powerful in these preventative and proactive care cases. I'm really passionate personally about rescue dogs, got a couple of my own, and I know how difficult it can be to manage dogs when you don't actually know what their start in life was. And we know for all animals, your start in life, the birthing method, whether it was a cesarean or vaginal birth, whether or not an animal had been breastfed, how long they spent with their mother, all of these things have a significant impact on the microbiome. That first development of the microbiome is so, so important. And if you've got a dog with unknown background or unknown medical history, this can be a really, really great way to be proactive about their health. Following on from this pathogen example, it's also worth noting the report doesn't just flag these potential disease-causing bacteria. We also give this clear breakdown of 12 core bacteria for owners, as well as the vets receiving this complete species breakdown, which gives a lot more detail. But we know that interpreting hundreds, if not thousands, of species of bacteria, probably not that practical in a clinical setting, and you're not microbiologists. So that's why we have made these into health indicators. And this is a really key, unique part of gut discovery. They summarize the functional performance of the gut, so digestion, immunity, metabolism, broader health as well. This is based on patterns we've validated across thousands of canine microbiomes using machine learning. This is the thing that makes gut discovery really quite unique. Instead of leaving you to sift through long lists of bacterial species, we translate the microbiome into simple, meaningful, functional scores that you can use straight away. You also still get that full list of bacteria species for anyone like me who really likes to geek out over it. I'm just going to highlight a case study. So this is a really interesting one, and it came from us through an ongoing collaboration with the Liverpool Dermatology Centre, part of the Liverpool University Vet School. And this is a really classic example of why function matters more than simply counting species. So this was a non-responsive dermatitis case. She was a beagle, and she had serious issues with her skin, but also was really experiencing gastrointestinal issues too. So anal gland issues as well as constipation. Interestingly, her diversity score was really healthy. It was really, really high. And often you'll hear this idea that high diversity generally means good gut health. But it's so much more complicated than that. Diversity alone doesn't suggest a stable ecosystem, but the functional health indicators do reveal that the microbiome was not supporting the dog's gut health in any way. The key insight was the bacteria were well proportioned, but they weren't the right bacteria. The major finding is that there was a really high abundance of Streptococcus species. Streptococcus, very normal in low levels. This dog, over 60% of its entire microbiome was all down to Streptococcus, a clear overbalance and a clear sign of dysbiosis, despite having this high diversity score. In terms of the results and what we can do about it, at first glance, a dog with gut and skin issues, especially this persistent, you might expect pathogens to be the main driver. But the gut discovery actually showed we had very low levels of pathogens, and these were not clinically concerning. Plus, the diversity looked healthy in this case, and that can be misleading. But when we look at that deeper thing, like the richness and the resilience being low, this tells us the microbiome is not robust and it is struggling to recover from these disturbances. So even though this is a dermatological case, the lowest health indicator score was actually inflammation. This highlights that gut immune skin axis we've been speaking about. It also shows how dysbiosis can manifest away from the gut. The microbiome is underperforming functionally. So the focus is the intervention to support short-chain fatty acid producing and anti-inflammatory bacteria. We can do this by increasing dietary fibers, adding oils, and including key nutrients and vitamins, because this dog's overall microbiome and nutritional intake seriously needs support. And in the report, we can see where this gives the clear, practical feeding suggestions and guidelines on what can be provided. And it's not just one dog. We are consistently seeing these improvements across our entire database. Here we have 4 additional dogs who completed the gut discovery testing and then retested following our recommended targeted diet and supplementation. What you can see across all 4 cases is the same consistent pattern, restoration of those key bacterial species, particularly Peptia aciobacter, which I've highlighted with purple, and Blautia hansenii, which is highlighted with those yellow arrows. These ones that we saw overgrown in the atopic dermatitis and chronic enteropathy cases were actually underabundant in some of our functional dysbiosis cases. These species are such important markers of gut stability, and being able to see these consistent improvements across the dogs is really exciting. I also want to draw your attention to Dave in the bottom left, this 7-year-old boxer. Dave is a dog that had severe malnutrition. We spoke about dogs with obesity and how their microbiomes compare. We simply don't have enough dogs that suffer with malnutrition to be able to look at this statistically. But you can see Dave is such a clear example of when just a clear overabundance of one species. And after just 3 months, we're starting to see more species start to come. He's only halfway through his supplement plan, so he's still got more work to go. But I think it's a really good example of what the microbiome looks like in a dog that's been malnourished and that complete loss of species and balance. And microbiome testing is going to be the future for veterinary practice. We've really just focused today on talking about fecal microbiome testing, but this is going to be the next diagnostic frontier, and not just for gut-related conditions. It's already revolutionizing human care and medicine. We're starting to see dogs, but the technology does scale. We want to do cats, exotics, livestock. Each has its own microbial system, but the same principles apply. And it's not limited to fecal testing. Skin and oral microbiomes offer completely new windows into inflammation, immunity, behaviour, and chronic diseases. We also want to move beyond bacteria. The future includes mapping yeasts, fungi, viruses, and understanding how these communities interact with each other in their ecosystems. At Biome9, we're already expanding this work through our own research and through collaborations with universities, vet schools, industry partners, and charities. The longer term, this opens doors for tools like fecal microbiome transplant and truly personalized care. This is truly just the start. And so with that, hopefully now you've all got this understanding of dysbiosis, how to decode the gut and transform outcomes. If you haven't visited us already at E60, do come, because we've got a completely free CPD and it's online, so you can do it in your own time. You can trial gut discovery in your clinic. We've got discounted rates for stockists who are present today. And you can also book a consultation with us if you want to learn any more.